Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Knee pain at night causes and treatment. Knee pain at night is a common discomfort that can be caused by injury, arthritis, bursitis, gout, and more. This pain at bedtime is not only frustrating but also can lead to pain-induced insomnia, which can leave you exhausted during the day. This article discusses the causes of knee pain, why it's often worse at night, and how to treat it. /r/n/r/n illustration by Theresa Chiechi for Verywell Health /r/n/r/n No single condition causes nighttime knee pain. Throbbing pains can come from a variety of musculoskeletal conditions or injuries. Sometimes knee pain isn't due to an underlying condition at all. Instead, heavy physical activity, lack of use, sitting in a constrained position, or sitting on your knees for a long time can cause knee pain. /r/n/r/n Some of the most common sources of knee pain at night include runner's knee, osteoarthritis, bursitis, or injuries. Some of these conditions, like runner's knee, may resolve after you rest your knee. Others, like osteoarthritis, are chronic conditions. /r/n/r/n Early morning joint stiffness is a characteristic feature of an inflammatory process causing knee symptoms that is worse on awakening after a night of not moving the knee joint. /r/n/r/n Runner's knee, also called patellar tendonitis, is one of the most common causes of knee pain in athletes. If you have runner's knee, you may feel an ache behind your kneecap, a dull or radiating pain near your knee, or a grinding feeling near your kneecap. /r/n/r/n The pain from runner's knee begins when the kneecap does not move properly and rubs against the lower part of the thigh bone. This may occur due to /r/n/r/n In most cases, runner's knee symptoms go away after several weeks of resting from strenuous activity and taking over-the-counter (OTC) pain relievers as needed. /r/n/r/n Unlike most mild cases of runner's knee, osteoarthritis symptoms are not temporary. Osteoarthritis is a chronic illness, so you should consult your healthcare provider to make a long-term treatment plan. In a healthy knee, soft tissue, including cartilage, cushions the three bones, thighbone, shinbone, and kneecap. These tissues are shock absorbers that support your body weight when you walk or fall. The cartilage in your knee helps your knee bend without the bones scraping against one another. In knee osteoarthritis, these soft tissues gradually wear away. This can result in the knee bones rubbing against each other, resulting in irritation, inflammation, and pain. Osteoarthritis pain can flare up and may feel like stiffness or aching when you bend a knee or stand. Swelling and throbbing are also common symptoms that may seem more pronounced at night. /r/n/r/n There is no cure for osteoarthritis because there is no way to completely repair or replace the damaged or eroded joint tissue. However, people diagnosed with osteoarthritis have treatment options to reduce their pain and prevent further damage to their knees. /r/n/r/n Rheumatoid arthritis, RA, is a chronic autoimmune disease that affects multiple joints throughout the body, including the knee joints. /r/n/r/n In rheumatoid arthritis, the synovial membrane that covers the knee joint begins to swell. This results in knee pain and stiffness. /r/n/r/n There isn't a cure for RA, but there are several treatment options including medications, reducing joint stress, physical and occupational therapy, and surgery. /r/n/r/n Post-traumatic arthritis develops after an injury to the knee. For example, a broken bone may damage the joint surface. Meniscus tears and ligament injuries can lead to arthritis years after the injury. They also may occur due to degenerative changes, age-related wear and tear. /r/n/r/n The pain is similar to osteoarthritis pain and often includes stiffness and swelling. People may experience more pain with changes in weather or during long periods of rest such as sleeping at night. /r/n/r/n Bursitis can cause painful swelling over your kneecap or at the side of your knee. In your knee, there are small sacs of fluid that help allow tendons to glide smoothly over your joints. These sacs are called bursae. In bursitis, these sacs of fluid get irritated and swell, which puts pressure on the adjacent parts of the knee, causing pain. /r/n/r/n Bursitis, like runner's knee, can be provoked in several different ways. The most common cause of bursitis is putting too much pressure on your knee, such as by kneeling or squatting without wearing knee pads or braces for support. Sometimes, a bursa can become inflamed after you hit your knee during an injury. /r/n/r/n Bursitis is like runner's knee in that it is often caused by overexertion. However, bursitis is less common than runner's knee. /r/n/r/n This condition also leads to several symptoms, like swelling, that are distinct from runner's knee. Symptoms often include a swollen kneecap. You may experience pain when bending the knee joint, and the pain may seem worse at night. /r/n/r/n Gout is a painful form of inflammatory arthritis that usually affects the big toe but can develop in any joint, including the knee. When the body has high levels of uric acid, sharp crystals form in the joint causing sudden bouts of pain, swelling, and tenderness. /r/n/r/n Symptoms typically include intense pain, swelling, redness, and warmth to the touch. Gout flares start suddenly and can last days or weeks, followed by weeks, months, or years of remission. /r/n/r/n A common cause of knee pain in growing adolescents is called as Gaucher disease. It's not really a disease, but instead inflammation of the area just below the knee where the tendon from the kneecap attaches to the shinbone. /r/n/r/n This type of knee pain most often occurs during growth spurts, when bones, muscles, tendons, and other structures are changing rapidly. Usually rest, ice, and OTC pain medication, along with stretching and strengthening exercises, will relieve this knee pain with time. /r/n/r/n Because the knee is the largest joint in your body, it is prone to injury and strain. If you fall or bump your knee, you may experience pain from bruising. If you've fractured any of the 3 bones in your knee, you may experience weakness, sharp pain, or deep throbbing sensations. /r/n/r/n Many knee conditions, like runner's knee, bursitis, and growing pains, will improve after several weeks of rest. However, your knee pain may become worse at night. There are several possible reasons. /r/n/r/n When your body is at rest, you may notice the mild to moderate pains that you could more easily ignore when your mind was preoccupied with busy thoughts during your waking hours. Additionally, when you sleep, your body produces less cortisol. While high cortisol levels can lead to heart disease, healthier levels can help your body reduce inflammation. /r/n/r/n Since most joint pains are caused by or worsened by inflammation, moderate amounts of cortisol can help your body manage this inflammation. But when your body is relaxed, such as when you're trying to go to sleep, your body has less cortisol to mitigate the swelling and irritation in your knees. /r/n/r/n When you sleep, your body is at rest. The hours of laying still can cause your joints to feel stiff and less flexible when you wake. Your leg isn't moving, which causes muscles and tissues around the knee joint to tighten up. /r/n/r/n While overexertion can cause knee pain, some moderate amount of activity helps keep your joints healthy. Low-impact activities like walking, swimming, and yoga can keep your joints loose and flexible. /r/n/r/n Such movement can actually help keep your tendons limber and can circulate fluid that helps lubricate and protect your knee joints. People with chronic conditions like arthritis tend to experience better health outcomes and less pain when they engage in a regular exercise program approved by their healthcare provider. /r/n/r/n It can be easy to get stuck in a cycle where you can't sleep because of knee pain. That lack of sleep can actually make your pain worse. Sleep is vital for healing and rejuvenation. Without sleep, you have less energy to expend on healing as you need to focus your bodily processes on staying alert and awake. If nighttime knee pain causes you to toss and turn, you may end up accidentally further straining your knee by sleeping in an uncomfortable position. /r/n/r/n If you're concerned about whether your knee pain is serious, talk with your healthcare provider. Some signs to seek medical care include /r/n/r/n if an injury caused an obvious deformity at the knee joint, or if the injury causes a popping or crunching noise, you should see a healthcare provider right away. /r/n/r/n With a proper diagnosis, your healthcare provider can help you get the treatment you need to rest easier. For example, they may recommend you take curtain medications, make lifestyle changes to promote better sleep, or consider other therapeutic options. /r/n/r/n To help alleviate pain, many people use non-steroidal anti-inflammatory drugs, NSAIDs. Some common NSAID pain relievers include Advil, Motrin, and Aleve. These basic NSAIDs can be purchased at a local pharmacy, but talk to your healthcare provider about the risks of long-term NSAID use. /r/n/r/n Medications to treat specific conditions, such as gout and rheumatoid arthritis, can also help knee pain over time. /r/n/r/n However, your healthcare provider may prescribe a more powerful narcotic pain reliever such as high-singular hydrocodone. These medications can help provide relief from severe pain but can be highly addictive. Consult your healthcare provider before taking any new medications. /r/n/r/n Heat from a hot water bottle or heating pad can help to improve joint pain and reduce stiffness. For cold therapy, an ice pack can help to reduce pain, inflammation, and swelling. /r/n/r/n If it's a chronic condition that causes knee pain, some people benefit from applying both, alternating between heat and cold therapies. Start with heat, which increases blood flow and offers some initial relief, but then apply ice to prevent the blood from pooling and swelling in the area around the joint, which would make the knee throb. /r/n/r/n While pain can disrupt your sleep, you can promote a more restful night when you include these sleep hygiene strategies into your daily routine. /r/n/r/n Solar 22, Getty Images /r/n/r/n Physical therapy may be recommended for certain conditions, such as rheumatoid arthritis, osteoarthritis, and some knee injuries. /r/n/r/n Acupuncture is a popular form of alternative medicine that many patients use to cope with mild to moderate arthritis symptoms. The American College of Rheumatology has listed acupuncture as a conditional recommendation for osteoarthritis. Consult your healthcare provider about including acupuncture in your treatment plan. /r/n/r/n A knee pillow can also help support and stabilize your sore knee when you are trying to sleep. /r/n/r/n Knee pain may be caused by repetitive stress injuries, called runner's knee, osteoarthritis, bursitis, or other conditions. It may be more apparent at night because you're at rest, but it doesn't have to derail sleep. /r/n/r/n Treatment options such as rest, heat, and ice packs, as well as NSAIDs, prescription pain relievers, medications for specific conditions, physical therapy, and complementary therapies such as acupuncture, can help manage discomfort. Keeping good sleep habits can also help you get to sleep and stay asleep. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.